Sports Chiropractic of Utah, your health performance and wellness specialist of Salt Lake City. We are continuing our Get Your Move On campaign, where today, by popular demand, we're going to talk about the knee. A lot of people suffer from knee problems. Many think, oh my gosh, I have a knee problem. My knee hurts right here, it hurts right here, or even back here. That's a common complaint that we get here in our office, and we want to talk to you a little bit about what causes this knee pain, because here's the myth that's going to be busted, you guys. If you have a knee problem outside of like the major ligament tears and sprains, so you have the ACL, PCL, LCL, MCL, and even meniscus, outside of those things that we would consider most likely traumatic, you actually experience knee pain because of a problem somewhere else. So inherently, just so you know, the knee is supposed to be a very stable joint. The ankle is supposed to be very mobile, and the hip is supposed to be very mobile. So if we have a breakdown in any of those two areas, we could get increased wear and tear on our knee. How many of you may know runners who experience what they call IT band syndrome? So that is where they get this outside knee problem or this outside knee pain and towards the front of their knee as well. When they run, they really get it and it tightens up. They're like, oh my gosh, my knee hurts right here. I have to treat the IT band, right? When in reality, what's been happening is their hip muscles become very, very fatigued, and then they cannot stabilize your knee, so you're constantly getting your knee caving in when you run, and the IT band is doing its darndest job to keep your knee from collapsing in. So really, you experience a symptom here, but the problem is most likely a lot higher. So think about that. If you have a knee problem outside of a traumatic injury, think about it. Are your hips tight? Are your ankles really stiff? Are your calves really tight? Those are some common things that we see. So today we want to go through a couple different things. We're going to show you, one, how to really warm up those muscles and kind of help them feel a little bit more loose. We're going to use a foam roller. And we're also going to show you a great exercise that will help take a lot of the focus off of your knee. And it is an exercise you probably have all seen before, but we want to review it again. So stay tuned, watch these stretches and this one exercise to help alleviate a lot of that knee pain. Alright guys, the first exercise that we're going to do for your knee is actually involving a foam roller. You don't need a super fancy pants one like this. All you have to do is just hop onto Amazon, type in foam roller, and probably get the cheapest one. I think you can get it for $9.99. Plus if you're Amazon Prime members, you get free shipping, which is cool. So anyway, go get it cheap. You don't need a really super duty foam roller. You can get the 12-inch kind or the bigger kind. It really doesn't matter. Something very inexpensive is still very, very effective. So what you want to do, we're going to focus in on a couple different muscle groups. We're going to focus in on our quads right here, our outside hip, and then a little bit on our hamstrings as well. So the first, to target the quads, what you want to do, lay this thing on the ground. You want to lay forward like this. We're going to start on the outside quad muscle. We're going to roll back and forth, just like this. What you want to do is find those really tender spots, stop for a second, right on that spot, kind of fold over that foam roller, and then continue, just like this. This exercise, and we're going to go towards the middle now, this exercise really doesn't loosen up the muscle. What it does is it kind of wakes it up, gets it going a little bit, kind of as a warm-up. So this is what I would recommend if you're going to warm up for a race or something like that. Just wakes the area up. So now that we've got the quad, we're going to switch to the back side of your booty here. Okay, we're going to put your leg up, and if we're doing the right side, we want to fold our leg over just like this in a figure four. We're going to roll back and forth. A lot of you will experience a lot of tenderness right through here. I feel it as well, right through here. A lot of those muscles get really tight when they're overworked. So what we want to do is just give a nice little, basically a little rub down of those muscles, wake them up, let them know, hey, it's all good, keep doing your job, you know. So there's that one, and then we're going to move to the hamstring, very, very easy. Just right here, roll back and forth, find some tender spots, wake that muscle up. So again, the knee, even though we're not focusing directly on the knee, we want to focus on the muscles that are around the knee. So next we'll show you the exercise that is awesome for knee pain. Alright guys, the exercise that we're going to focus on is the assisted squat. There are many people that have many different ideas of what a proper squat looks like. The most important thing for us, especially with people with knee pain, especially that front side knee pain right through here, or even on the bottom side of your knee, is we want to make sure that you're not using too much of your quadriceps when you squat. So a lot of people that we see squat really, really heavily in the front, their knees shoot over their feet, and they get a lot of quadricep movement. So what we want to do is actually train the other side. We want to make sure that our glute muscles and our hamstring muscles and our back muscles are involved when we perform the squat. Because this eventually what it'll do is take a lot of the pressure off the front side, which will eventually hopefully alleviate a lot of your pain. So what we want to do is have an assisted squat where you use the TRX system. You can use another band. Heck, you can hang onto the door frame. Just make sure that you're secure in whatever you do. To do so, what we want to make sure is we're going to allow ourselves to sit back into a chair. So you want to have something that's very, very sturdy. So to perform this, what you do is you just grab your band, whatever it is, and gently lower yourself into that squat position. Notice how my knees are not shooting forward over my toes. This is getting the proper glute muscles and hamstring muscles involved. It allows me to sit up nice and tall. I'm not bending over from the back, causing a lot of back tension. So we are training all of the muscles surrounding our hips and our hamstrings to work instead of the front side of our quad. So give this a shot. Make sure you're doing proper form. Make sure you do it with someone initially so you don't fall. But give it a try. See if after a few days, or maybe even a couple weeks it may take, see if it'll start alleviating a lot of that front side knee pain that you experience. Thanks for tuning in, guys.